My shoes are very loud, I apologize. So I'm Sharon McCary, and I have had the very good privilege to be a member of the Alliance for very many years, so when it was CASDA as well. I'm first and foremost the solo parent of 2 neurodivergent young adults, one of them with autism, and they have been my inspiration to go down a path of advocacy, and I created an early education inclusive center 16 years ago, where we've been still supporting parents in their early years before the kids get into the education system. But I've also had the privilege for the last 4 years of being a member of the Disability Advisory Committee with Canada Revenue Agency. The last 2 years, I've been the co-chair alongside of John Lai, which has been wonderful. We work on a lot of things to help change current practices within the Canada Revenue Agency, and all of the members on that committee have been appointed by the Minister of National Revenue. So just before we start our panel, I wanted to put into context our next panelists and their role within the government. The Canada Revenue Agency reports to the Minister of National Revenue. They have a very large org chart, and it's a little bit different than other agencies. They report to a commissioner, a chief executive officer, and then there's a board of directors and a number of other officials, including a tax ombudsman. They're accountable to Parliament and to the Prime Minister on all operations of CRA matters, but they do not direct the officials on interpreting laws, and they are fully accountable for the administration of programs, benefits, including the modernization of the new digital DTC form, which is the disability tax credit. So on that note, I'm going to invite our panelists to come up to the stage. We have 3 people with us today. We've got Sujata Verma, who is the Director General of Disability, Indigenous and Benefits Outreach Services at the Directorate. We have Melanie Gorges, who is the Director of Disability Benefits at Canada Revenue Agency. We've got Mike Joy, who is the Manager of the DTC, just the Disability Tax Credit Modernization Section. And we've got Brad Taschuk online with us this morning. He's the Senior Program Manager in Modernization. So welcome.
Good morning, everybody. Thank you very much, Sharon, for a very generous and thoughtful introduction. It's always interesting to hear somebody else speak about the agency and in such an honorable light. So thank you very much for that. At the very outset, I just want to say a sincere thank you and my gratitude to the organizers, specifically, Jonathan, to yourself, for inviting the Canada Revenue Agency to this summit, to this very valuable conversation, and for giving us a seat around this forum. So thank you very much for that. Sharon, thank you. As Sharon mentioned, my name is Sujata Verma. I am a woman. My pronouns are she and her. I am in my early 40s. I'm about 5'5". I am a brown skin tone. I'm East Indian by origin. I'm wearing beige pants, a printed shirt, a brownish jacket, and a beige headscarf. As Sharon mentioned, I'm joined by a number of my colleagues here in person and virtually with Brad to talk about the Canada Revenue Agency, more so from a perspective of the administration of the disability tax credit. Before we sort of launch into our conversation, the Honourable Minister Marie-Claude Bibeau was supposed to be here today, was scheduled to be here today, and she is unable to do so, so certainly sends her regrets to not be present here today. But we're here to try to be able to walk you through some of the administration of the disability tax credit. One of the more important tax credits that the Canada Revenue Agency administers on behalf of the Department of Finance, that clearly sort of outlines policy and administration and tax law rather. So as Sharon mentioned, the Canada Revenue Agency is responsible for the administration of taxes, benefits, several other programs. And in doing so, clearly we do our part in contributing to the socio-economic well-being of Canadians. And almost equally important, if not more important, in my view, more important, because this happens to be our work, is the administration of benefits and credits for some of the most vulnerable and hard-to-reach populations across Canada. The disability tax credit, or the DTC that we often refer to it as, is one of those important tax credits. As you all know, it's a non-refundable tax credit and is not just for persons with disability, but can be extended to caregivers, to family members, etc., to reduce the amount of tax that they may have to pay. Sharon mentioned the Disability Advisory Committee, and I can't stress enough what an important role the Disability Advisory Committee, which is an advisory body to the Minister of National Revenue, plays in the administration, or in the streamlining rather, of the administration of the DTC. And that is evidenced by the fact that the DAC, as we affectionately refer to them as, or the committee, that is evidenced by the fact that the last 4 reports that the DAC has published and put out have led to significant streamlining efforts that the agency is quite proud of from an administration perspective, both from an application standpoint, from a communications perspective, and then also looking at service enhancements, clearly within the parameters of what the DTC allows us to do. I also do want to mention that it is because of the work of the Disability Advisory Committee, and quite frankly, the open, collaborative, effective relationship that the agency has with the Disability Advisory Committee, that we've been able to advance legislative changes. I'd say 3 budgets now in a row, 3 federal budgets in a row, the most recent being the one that was tabled on Tuesday. Speaking of the budget, I also would like to acknowledge the fact that it is somewhat premature for the Canada Revenue Agency to preside on details of scope, of administration, etc., of what was just announced, just a couple of days ago. So I just sort of want to establish that as well. Clearly, the Disability Advisory Committee is co-chaired by Sharon and Jonathan, along with my Assistant Commissioner, Gillian Pranke. And the role that they play is quite significant in terms of some of the enhancements that we have been able to make in the last few years, some of which we're here to talk to you about today. So with that said, for the next segment, I'm going to introduce Michael Joy. Mike started his career with the Canada Revenue Agency in 2001, and since then has taken on several different roles and influenced agency processes and procedures through his leadership. In the thick of the pandemic, he took on the absolutely courageous challenge of trying to modernize the disability tax credit, or the administration of the disability tax credit, in order to make it more accessible to Canadians who were most in need of the DTC. With that said, Mike, take it away. We're here to take questions at the end of it all as well, so we'll be happy to re-engage. Thanks.
Thank you, Sujata. Good morning, everyone. Hopefully, April showers bring May flowers, because I'm soaking wet. I don't know about the rest of you. Thank you for the opportunity to speak ever so briefly to you this morning about the CRA's recent efforts to modernize the disability tax credit. As both Sharon and Sujata introduced, I'm Mike Joy. I'm the manager of our DTC modernization section at the CRA. And I've been with the CRA for over 20 years. A strong admirer of Sujata's leadership. I joined the team in 2021, and I have to start by just saying that I've never met a better group of caring people who are passionate, dedicated, and fully committed to helping people with disabilities. And I say that with all honesty. I was on the business side, and we were helping small business owners, and I came to DTC, and there is a passion there. So I'm really proud to be part of this team. With the oversight and guidance of the Minister's Disability Advisory Committee, some members, like Jonathan, I don't know where Jonathan's disappeared to, have been making concerted efforts to simplify the application process, remove barriers where applicable, and make the DTC more accessible. I will not go much further into what the DTC is. Sujata already mentioned that. But Canadians who have a severe and prolonged impairment may apply for the credit, and if approved, may then claim that credit on their tax return. For those with low or no income, they may not need the full disability amount to reduce their income taxes, and in those cases, they can transfer some or all of the disability tax credit to a supporting family member. By reducing the amount of income tax individuals may have to pay, the DTC aims to offset some of those extra costs related to the impairment. And this is an important factor because the DTC is a tax fairness measure as opposed to the other federal and provincial social benefit programs. The DTC, having DTC eligibility, can also help people gain access to additional tax deductions, credits, and benefits. For example, the DTC eligibility opens the door to the Child Disability Benefit, the Registered Disability Savings Plan, or the RDSP, the Canada Workers Benefit Disability Supplement, and, as you heard as of Tuesday's federal announcement, the new Canada Disability Benefit, which is expected to be launched in 2025. Budget 2024 further announced that to ensure access to the CDB for eligible Canadians and to address an anticipated significant financial barrier, additional funding was proposed to cover the cost of the medical forms required to apply for the disability tax credit. And that's brand new, that's exciting. You know, you go to your doctor and you've got to pay $100 out of your pocket. That's a game changer for some people. For the DTC, it's also important to note that the eligibility is not based on a medical condition or on a diagnosis. It is rather on the effects of that impairment. And that's the challenge, of course, with autism and the spectrum, and we recognize that. We have 2 slides. Brad, do you have the slides there? Ooh. My Vanna White. So we've just recently published some new disability tax credit statistics on Canada.ca. They're also available on the Open Data portal. So you can see on this first slide here the number of individuals with a DTC certificate. The numbers generally show a growth over time, and we currently have about 1.4 million unique certificates. We recognize that there are a significant number of Canadians who have disabilities, and 1.4 does not quite cover that. Various reasons for that, potentially a lack of awareness, and maybe there's no tax benefit for me, so therefore I don't apply. That, of course, will likely change with the announcement of the CDB, where those who did not apply will apply now in order to get a monthly benefit. So we expect an increased take-up. As you can see on the slide, you have significant numbers in the mental functions and walking categories, and with, again, you look at that mental functions, that graph is growing. So mental function disabilities is increasing in Canada. Moving to the second slide. There we go. The second slide here shows the distribution of those same certificates by age group, and as expected, the number of individuals with a disability tax credit increases with age. But it's noteworthy to see that there is a large number of Canadians under 18 who have the DTC. The majority of DTC applications received related to autism are submitted under the mental functions impairment. However, other categories often do apply, such as speaking, dressing, feeding, and elimination. The definition of mental functions necessary for everyday life include adaptive functioning, attention, concentration, goal setting, judgment, memory, perception of reality, problem solving, regulation of behavior and emotions, and verbal and nonverbal comprehension. The CRA has made applying for the DTC easier than ever, especially with the new digital application form option. To apply for the DTC, the person with the impairment or their legal representative must complete and submit a Form T2201, the Disability Tax Credit Certificate. The T2201 is divided into 2 parts. Applicants or their supporting family members fill in the Part A, and a medical practitioner completes Part B. In efforts to reduce barriers to make the DTC more accessible. The CRA is working in consultation with the DAC on how the agency can improve the way it administers and interprets tax measures for Canadians with disabilities. Over the years, the DAC's advice and recommendations have helped the CRA take multiple steps to improve the DTC application process and make it simpler for persons with disabilities, including those with autism, and their medical practitioners to apply for the credit. Some improvements that I'm just going to go through are updating and condensing the T2024 form to make it more user-friendly, introducing a fully digital DTC application process to make it faster and easier to access by completing the form, which we'll see in a moment. And look, I get it, not everyone is tech savvy. If we need help, you can call the agency and talk to one of our call agents who can help answer any of your questions related to the DTC, but who can also walk you through the application and capture the information for you. So you don't, I can't use a digital app, call us, we can do that for you. We can get you your Part A, and we'll get a reference number you give to your doctor, they can do their Part B. We've simplified and improved our DTC information on our website, optimizing it for accessibility, readability, findability, and understandability. We've developed a client experience survey to collect public feedback and to inform ongoing improvements to the DTC program. We've updated the look and content of all of our external correspondence, such as the Notice of Determination, and have facilitated the on-the-line delivery of our correspondence. We continue to provide increased outreach and educational support to vulnerable populations, both virtually and in person. And for example, our outreach program has 23 active partnerships with organizations that specialize in support for individuals with autism. Last year, outreach officers delivered multiple sessions to these organizations and have shared many promotional emails and stakeholder messages to their networks about the DTC taxes and benefit and credits. We are committed to making the DTC more accessible for persons with disabilities, particularly for individuals living with autism. There's still more for us to do. We're aware of that. I think you have some good advocates in Jonathan and Sharon. They're at the table with us, twisting my arm on a regular basis. So we're trying to make those improvements. And of course, with your support, I think we're on the right path. So at this point, I just want to introduce, you see on the screen, Brad Taschuk. He's a longtime DTC assessor, resource officer, and a senior programs officer on my team. Really, he's the brain trust for the successful implementation and launch of our digital app. And so he is going to walk us through a very simple digital application, and time permitting, we can take questions at the end. So Brad, I pass it to you, sir.
Thank you very much, Mike. I just want to make sure that everyone can hear me. I think there was a comment in the chat that people could hear my typing, so I'm going to assume that you can. As Mike said, my name is Brad Taschuk. I've been with the agency for about 7 years now, or over 7 years now, and working on the DTC that entire time through a variety of jobs, from being an assessor to training other assessors to working in headquarters to eventually joining the DTC modernization team and having a chance to work on some of the great initiatives that our team has been able to undertake and implement. So I know Sujata said that Mike courageously took the job. Part of that was having to deal with me on a regular basis. So kudos to you for doing that, Mike. So what I'm going to do is I'm just going to walk us through a simple DTC application using our My Account portal. So as Mike said, there's also phone channels available for DTC applications, but the majority that we're seeing since we've introduced these digital application methods we're seeing them come through My Account, so people applying online. So as you can see here, I've logged into My Account. Don't worry, none of this information is actual taxpayer information. This is a test account, so you're not seeing anything that you shouldn't be seeing. And our DTC application is housed in the Benefits and Credits app, or Benefits and Credits tab. So if you were looking for GST, any of the CCB, any other benefits that CRA pays out or administers, you'd be able to find that here. and our DTC information is down at the bottom. So traditionally, we're not going to see something that has 32 different applications in here. As I said, this is a test account, but we're going to add another one to that list today. So this table will show any applications that have been received through our digital or phone channels. You'll see the name of the applicant, the year it was submitted, and the status of both Part A and Part B, because they are separated in our digital application. There's also the ability to view an application summary, both while the application is in progress and once it is completed. The application summary, once the application has been completed, is actually a full copy of Form T2201 that we would be receiving and assessing in our tax centers. But enough about that. I know I've got limited time here and I do not want to waste it. So let's get started. So as you can see, before we begin, there's some general information, links to our DTC websites, privacy statements, all that good stuff that we need to acknowledge before we start an application. After that, what we do is we identify the person with the disability. So in this case, what we would do, oh, I can see everybody now, that's lovely, is there's a couple of pre-populated options in here. So the My Account user can select themselves as the PWD, or if they have any children in their care, meaning that they are the CCB recipient for that child, they will also populate in this list. So in this case, what I will do, because most of the applications that we see for autism spectrum disorder are for children, we'll select one of the children here, so Nima. Once an individual has been selected, their basic information populates on the screen, and we just want to make sure that that is all correct. In this case, we will say it is. If not, you would be directed to the profile screen to update that information. So as you'll see, if you're familiar with Form T2201, the flow of the digital application pretty much follows the same flow that the paper form does. The second piece that we get here is to identify the person who would be claiming the disability amount. So this is a little bit more limited. It can be the My Account user, again, that could be claiming, or it could be a supporting family member. So if there's an example where someone's claiming, but perhaps there's better tax benefits to be had by the other spouse claiming the disability amount, they could indicate all of that information in here as well. But to keep things simple and keep them moving along for right now, we're just going to say that Kalimula will be claiming the DTC amount herself. And then we get a couple additional questions. So if eligibility is approved, would you like the CRA to adjust your previous tax returns? Most people are saying yes to that question. And just a couple additional questions about the relationship and if the PWD and the supporting family member live together. Once those are all complete, we just get to a review and submit page. So we just repeat back all of the information to make sure that it is correct about the PWD, about the claimant, and then there are a couple of authorizations that need to be completed before it can be submitted. So just that the information is correct. We need authorization that the medical practitioner who will be completing Part B can provide us information. And if the applicant has elected that they want to adjust their previous returns, there will be a third authorization there. Once that is all done, you submit, you get a confirmation and a reference number and instructions for what are the next steps. So in this case, it's fairly simple. You're printing and saving your instructions and providing them to the medical practitioner. That can be done with just an easily printable or savable page that we generate, which includes all of the information that the medical practitioner would need to complete their submission online. So what I will do now is we'll pretend we did a little bit of a time warp, and we'll say that Kalimula was able to share this information with their medical practitioner and move over to the medical practitioner section for Part B.
But I'm sorry, I'm just going to interrupt you for a second. I'm very sorry. I just am cognizant of time, and I'd hate for us to leave without having taken any questions at all. So I'm sorry to interrupt you, Brad. But I think we got
Quite
through
all right.
part A, and maybe we kind of just use the next very short amount of time to take some questions, please. I think that is part of our disability supports deduction. I do believe that that's included as part of the disability supports deduction and potentially part of the medical expenses tax credit as well. So yeah, those are specific details, but I do believe that it is part of what is covered. Yeah, I don't think we got into specifics of exactly what supports are covered, but you can, there's a lot of reference material that's available in terms of specifics. I'd hate to give you sort of, to misguide you at all, but there is information available both on our website as well as sort of through other sources that can specific. You could, yes, and you can look at the specific definitions. I think I saw a question at the back.
It's
Sorry.
Jonathan up here. Just because we have to be wary there's an online audience and they're not going to be able to hear the questions. So that's why we have the Slido. So if people do have questions, please feel free to use that, and we'll use that and have a moderated discussion that everybody can be inclusively included, because we do have a big online audience as well, and they're not going to be able to hear what's going on in the room except for what's going on up on the platform. So please feel free to do that. I know we have a few minutes left. I know the team can stay around if there's specific questions that you have on this application, because we know how important this credit is, especially in the landscape that we're entering after the budget 2 days ago. So yeah, just wanted to let everybody know, it's for accessibility for everybody else that's participating in this conference that are not in the room. Thank you. Yeah. So let's put the Slido up so we can have that for the last few minutes.
There's no question.
So we'll wait a minute or two. Slido's up if there's any questions coming through, and Sharon has that on her phone. Yeah.
All right, seeing no questions. Thank you so much for being here, and I'm sure people can, oh, somebody's typing? Oh. Okay. All right. On behalf of the many people with disabilities across the nation, I'd be quite interested in learning about how the DTC's modernization has led to a more inclusive and simplified definition, I guess, of disability. Anybody want to?
I'm not sure. Oh, great. That's a really good question, and I do want to stress sort of what both Jonathan and Sharon mentioned at the very outset, in that the Canada Revenue Agency is responsible for the administration of the disability tax credit. It's Department of Finance that sort of goes through the specifics of what's in the Income Tax Act, right? And so while that might sound like a bureaucratic response, that is sort of facts as they present themselves. I think the role that the Disability Advisory Committee plays is pivotal in bringing sort of data-driven evidence to the table. We do have a number of occasions where the Department of Finance, ESDC, and us are in a position where we meet with the Disability Advisory Committee together. And so those are avenues for us to continue to influence the definition, so to speak, of the DTC. And some of the legislative changes that have been made recently have been towards making it more inclusive and accessible.
Thank you. Another question, very popular here, and probably indicative of frustrations that are happening from physician level. The vast majority of the time when a patient has given us a reference number, it doesn't work. Said it was used prior, says it's not active. When this happens, is there a phone number or next step suggestion that you would have for the practitioner?
Sure, that's a great question. The reference number is one-time use and a unique number, so I would be, I don't really have an answer as to why the applicant is giving that number to a medical practitioner. It would be just for that applicant alone. So if they're using numbers that have already been used, there must be something in the communication between the applicant and the doctor's office.
But is there a phone number or a reference, like some?
Again, you
some
can
way
call
that-
the agency at any time. We can get you another reference number. We could actually just take your information and do the Part A at that time as well.
And it would be on behalf of the individual, not the practitioner calling for that
On
new
behalf of the
reference
individual,
number? Okay, thank you.
And there's absolutely nothing wrong. If you get to that position, the medical practitioner can still print and send that to us. They'll get their Part B. They've used the digital application. They'll get their Part B, give it back to the applicant who can either mail it to us or use Submit Docs. We'll get the Part A, Part B, and we'll take it from there.
them
So if they
together.
can't use the number, print it and send it to us.
Okay, thank you. We're going on the Slido, so we're doing different questions according to popularity here. So another one, and this is a common experience by many with children who qualify for the DS or the disability tax credit, but then they may lose it or they have to reapply. And why is there that need to reconfirm a diagnosis when we know that things like autism are lifelong conditions?
Brad, do you want to take that one, Brad? I do have a response, but.
Certainly. I would just say that as we noted before we started presenting, for the disability tax credit, eligibility is based on the effects of the impairment, not necessarily a diagnosis. So it's not about reconfirming the diagnosis. And especially when it comes to ASD, we know that a lot of times if you're diagnosed as a child or assessed as a child, there could be very different swings as somebody matures. So that could affect the eligibility. So that could be why we're looking for a second disability tax credit.
I guess that's a challenge with doing something that's impairment-based versus a diagnosis-based, because the diagnosis doesn't go, and yeah, okay, thank you.
Because we base it on the effects of impairment and we've got the severe and prolonged piece in there, right? We do also recognize that after a certain point in time, in some cases, clearly not every case, right, there could be an opportunity for assistance that may have helped the quality of living, right, or the quality of life, so to speak. In some cases, right, and I speak sort of, knowing that I'm not a medical practitioner, right, so, yeah.
Thank you. Right. You mentioned making the DTC more accessible. This statement speaks to the problem with the DTC. It is inaccessible to many. Have you considered a review of the people who are actually using it? Do you do that on a regular basis to see where the barriers and opportunities may be?
I was reading the question, sorry, as you were sort of reading along. I think, there's, as Mike acknowledged, there's a lot for us to continue to do, right? I feel like we have made, the process is not what it used to be 10 years ago. The process is not what it used to be just even a few years ago, right? Just from a perspective of us having been able to use technology, consult where we can. To the question about, have we considered a review with people, in fact, using the DTC? I think, again, not to put all of the burden on the Disability Advisory Committee, but when the committee comes as spokespeople from a variety of backgrounds of the community, they bring that perspective to us. At a variety of instances we have, partnered with other government departments to engage in focus groups, et cetera, with persons with disabilities to sort of get their perspective, right? But certainly point taken, you know, and I think this is a really good point, and it is so very much in line with nothing about us without us, right? So point taken, and I, you know, thank you very much, because that's a very large part of why we're here today.
Yes.
Yeah. Thank you.
Thank you very much for coming to be part of this presentation this morning. Sorry, I'm not talking to the mic. Thank you very much on behalf of all of us here and virtually. And I'm sure there will be opportunities for people to interact with you further and bring forward additional questions in time. So thank you. And I'm going to turn it over to Alexia to introduce our next panel.